Threw my documents on the floor.
There's on the floor again too. I don't know if you know.
Wow. How far do you want to move this back? Hey Kenny, we're gonna move these back just a little bit. Is that cool? This is the real pastor and boss here, so we'll see what he says. How far do you want it back?
Just maybe just a little bit. Yeah, that's
Is that good?
perfect.
Okay.
Thanks so much. Hey, Vanya, can you do it, mic check?
Yes. Oh, wait, sorry. Mic check, mic check. I was not expecting that. I love that. Mic check, mic check. Everyone good?
Yes, ma'am.
Perfect.
Thank you.
You said that with your chest.
Say it like you mean it.
Say it like you mean it.
Thank you. Appreciate it. Yeah. Yeah, she did.
Okay, thank you guys. Okay, we'll have her do like okay, perfect. Thank you so much. Yeah, thank you. Yeah.
High five is live.
You guys need a white balance?
I already got one, but
Got one?
yeah.
Okay.
This is a powerful mic, honestly. Like, you really don't even need to get up there like that. Did you all see the national anthem at the home run derby yesterday?
At the what?
Or was it the home run derby? What was it? Right?
Yeah, a game or a derby, right?
Yeah. Did you listen to it?
I feel so bad for that singer. I'm like, it's like a Fergie moment. And she's like that.
Yeah, the Fergie thing. I remember that. That's
Dude, I mean, I try to forget about it. But
yeah, that's a shot right down.
Mic check 1 2 3 4 5 6 7 8 9 10. Mic check 1 2 3 4 5. Mic check 1 2 3 4 5 6 7 8 9 10. Mic check. Okay. Good audio. Okay. You guys are loud and right?
guys for coming. I'm going to stage people right here, but just some housekeeping. If you have cell phones, please turn them off at this time just so we don't have any interruptions. Keep your questions related to the topic at hand. If you need a pull aside, I know Johnny, I've talked to you about that. I know Jason, I'm going to talk to you about a couple things after. But just make sure your questions are geared towards the topic at hand. You all should have the run a show for spelling. Press releases will be sent to your news desk right after as well.
Okay. We'll have you here. Barbara, we'll have you right here. Debbie Jo will have you here. And have you guys over there. Come in right here. Yeah, right there. And then I'll have you here. Are they all in the shot?
Good morning, ladies and gentlemen. We are in Doña Ana County today to make an important announcement for this community and frankly for patients and providers across the state of New Mexico. It has come to the attention of the New Mexico Department of Justice that ongoing concerns about management practices and billing practices and frankly the standard of care that is being provided at Memorial Medical Center is not only potentially in violation of New Mexico law, but from my standpoint and based on the things that I heard today, truly shocking and appalling. I was, I think, shaken by the public accounting and reporting of a couple of patients who I will introduce shortly, and the stories that they recounted about being turned away at a moment that I think every human being can relate to, and that is in a moment where they are scared, they are suffering from disease, they are looking for help, they are looking for treatment, and rather than finding an institution and a hospital that placed their interests first and their well-being first, they were turned away. And they were turned away for financial reasons. That's what brought me to Las Cruces today, is to learn more about their story and about the troubling and concerning allegations that have been made about why they were denied care at one of the two primary medical facilities here in Doña Ana County. So we had an opportunity to meet and learn more in a meeting with a number of stakeholders just prior to this press conference. And in that meeting, there were not only patients, but people who have been connected to Memorial Medical Center for some time, former employees. We heard from providers, we heard from others, and it is my judgment that the facts that were shared with our office just about an hour ago will not only support the announcement today that we are opening an investigation into Memorial Medical Center, but to profoundly expand the scope of that investigation. It is apparent to me that the management of this facility has failed to place the well-being and safety and care of their patients in the proper place and in the proper priority. It is apparent to me that decisions have been made and continue to be made from a standpoint that is primarily seemingly motivated by profit, by maximizing the bottom line, and without due respect and due regard for the patients under their care. The announcement that we make today is predicated on a number of allegations that, if proven, could demonstrate violations of a number of state and federal law, including the Unfair Practices Act, the New Mexico Indigent Hospital and County Health Care Act, and the New Mexico Patients Debt Collection Protection Act. I am happy to be joined this morning for this announcement by two individuals who I think deserve great respect and appreciation from this community for not only engaging in a battle for their lives and for their health, but by having the decency to identify publicly profound problems with a healthcare institution in this community, not only for themselves, but because they are concerned that others may suffer a similar fate if these issues aren't addressed. And so I'd like to start today by introducing Barbara Corral and Debbie Jo Mincer, and have them share a little bit about their experience with Memorial Medical Center. And then I will introduce and ask members of the local governing bodies, the County Commission and City Council, to provide their own perspective on what I think is quite clearly an institution in desperate need of reform and correction. And so with that, please allow me to introduce Barbara and Debbie Jo.
Hello, I'm Barbara. I'm a nurse. I've lived here since I was 7. I'm a taxpayer. I was an employee at MMC for 6 years and was proud to be a nurse there. In September of 22, I was diagnosed with vaginal cancer. My medical oncologist called a doctor at Memorial, Dr. Call, and said, hey, I have a nurse for you. This is, what's wrong with her, and let's get her started on radiation. Dr. Call said, okay, we'll get her started. Well, I wasn't probably even half a mile down the road when Doctor called me and said, they're not going to treat you because they don't take your insurance. At that time, I was paying $800 a month for my insurance, and I just couldn't even believe that a hospital in my town, my community, where I pay taxes, where I'm a nurse, where I've taken care of so many people, wouldn't provide care to me. I was just shocked. So I ended up going to Albuquerque, and I got amazing treatment. I would never, ever in a million years refer somebody to MMC. I feel like the level of care has gone down. The staff, there's not enough staff for the patient ratio, and it's just an unsafe place to be now. So, thank you.
Hello, my name is Debbie Jo Mincer, and I was diagnosed with breast cancer at the first of the year. I started into my care there at MMC just sort of stunned in general. There's no family history. So I ended up having my surgical procedure and then a follow-up appointment with my oncologist there at the cancer center. And that day I went in and they called me up and said, "Your Medicaid, I am on Medicaid. Your Medicaid has ended. Do you have any other insurance?" And I said no. And they said really quickly, "Well, we can't see you today then." And I stood there stunned, not really sure what to think or what to say. So I stood there probably 3 seconds, and they turned around and said, "Okay," and I walked out and spent the rest of the day scrambling, trying to find insurance that I could get in place. That shouldn't happen. I mean, I thought about it after I drove away, and they had told me, and I had met, that they do have social workers on site. They should have offered me that. There was no offer of self-payment. There was nothing, just, "We can't see you today." And that's something people shouldn't go through when their mind is not right anyway. And it was shocking and scary, and just not right.
I'm going to ask members of the City Council and the County Commission to share their perspective, but before I do, I want everyone in this community to think about what it would feel like and how it would impact themselves or someone that they love to be facing a cancer diagnosis and looking for help and getting the kind of response that Barbara and Debbie Jo got. As I said before, I think it violates potentially New Mexico law, but it violates something even more profound in our community, and that is an expectation that we do what we can to help. And I want to take a moment to reflect on something that was shared with us in the meeting with some of the people who have worked at Memorial Medical. And they went to great lengths to ask that I identify their commitment to the work, their devotion to patient care, and for all of us to do what we can to recognize that they want to do the very best by Debbie Jo and by Barbara and by others who are afflicted with this disease. And it is to their credit that some of the providers who shared information with us amplified and frankly identified additional concerns about billing practices at the institution, but perhaps even more troubling, a culture of fear, a culture where providers and employees of the institution, rather than being recognized for raising issues that have been identified for management to correct, they fear retaliation and they fear punishment. They fear that by speaking up, that they will pay a profound price. And I want each of them to know that the announcement today of this investigation should be a signal to them that we will be taking a very deep and detailed look into all of these allegations, but it should also serve as a signal to the management of Memorial Medical that any attempts to interfere with individuals who are associated with that institution and sharing information about its practices will not be looked on kindly and will be dealt with most severely by the Department of Justice. This is a time where everyone who is involved and cares about these issues needs to be centered and focused on one thing and one thing only. What's in the best interest of patients? That's what matters most. That's what we have to prioritize. And that's the nature of the investigation that we've announced today. That's our focal point. But make no mistake, anyone engaged in any form of retaliation against either patients who speak out or providers who speak out will be dealt with by this office and this agency. And with that, I'd like to call members of the City Council and the County Commission to come forward, share their perspective on what this means for the community and the impact that this will have for their constituents, and how I think we can all work collectively to move in a more positive direction.
Hi, good morning. My name is Joanna Bencomo, Mayor Pro Tem for the City of Las Cruces. I am here really on behalf of the many constituents who have reached out to me about their experiences with MMC. Thank you, Attorney General Raul Torres and the New Mexico DOJ for being willing to engage in this hard but important conversation with us stakeholders. This process that the AG has started didn't have to be an option. But ultimately, this is what happens when people feel not heard, when real stories and experiences are being outright dismissed. Accountability and oversight are important, and at the end of the day, what is most important is equitable